So you would do it, though. I mean, what if they're just totally insistent and you're really kind of, you're trying
Well,
to inform them correctly?
well, as you know, what I do is I do that with conditions, and one of the conditions
Right.
is that handwrite. I mean, handwrite a letter to the patient in my own handwriting that basically says, "I'm accepting you as a patient. I'm accepting this surgical um, endeavor."
Mm-hmm.
With the understanding that these are the things that I'm worried about or concerned about or could happen. Your breasts are not going to look the same. They're not going to feel the same. They're not going to be perfectly symmetrical. You may have sensory changes. If you have an infection, that you could get fluid around your implants, the breast could get really hard. You may have to have your implant removed. This is all written by hand. It takes me about 10 minutes to write these letters.
Right.
But that's the kind of thing that I do when I feel like I'm really being pushed out of my comfort zone. My comfort zone is pretty small.
Right.
But when I'm getting pushed out of my comfort zone about what I want to do with a patient, then I tell them, I said, look, these are the things you need. Because after surgery, they want, despite all the informed consents and everything else, patients want their body to look perfect. Let's face it. I want
Right.
my body to look perfect after I have surgery. I
Right.
would.
I
And I
do.
mean,
Right.
and so that's normal human nature. But the realities are different from that. The realities are the doctor's got to do a good job. He's got to select an operation that fits that patient. And the patient, on the other hand, has to realize that they have imperfections going in that may or may not affect the outcome of the surgery. It's not going to be perfect. It's
Mm-hmm.
never going to be perfect.